Hello, Dr. Vikki Petersen here. I want to speak with you today about a landmark study that just came out this past month, February 2012. And this is a long title, so I'm going to look down and read it to you exactly. It came out in BMC Medicine, and the title is this: Spectrum of Gluten-Related Disorders, Consensus on New Nomenclature and Classification. So this study was written by 15 different authors. It was a veritable who's who of very respected researchers from around the world. And basically what they did was they got together last year, October 2012, and they met with the purpose of getting their nomenclature, meaning how we talk about gluten intolerance and how we classify the aspects of gluten intolerance, and putting together a consensus and a paradigm for treatment, which was very good, so that we were kind of all on the same page. And I'm happy to report that it very much aligns with my thinking and what I experience with my patients. It very much validates our book, The Gluten Effect, that was published a full 3 years ago, where we talked about the existence of gluten sensitivity, the impact of gluten sensitivity, how serious it can be, and that was completely validated in this recent paper. So the reason I wanted to go over this with you is that still today, and unfortunately probably for some time to come, we have a lot of patients suffering from gluten sensitivity and celiac disease because they are incorrectly diagnosed. So the outline and basic paradigm of what they created as far as the aspects, the various facets of gluten intolerance were these. And by the way, there were 69 references at the end of this article. So this was very well documented as far as statements made and scientific research to back it up. So there were 3 different facets they looked at: a wheat allergy, so a true allergy, celiac disease, and gluten sensitivity. So basically for wheat allergy, there's something called IgE testing or scratch testing, and it is accurate for allergies. Allergies are mediated or created by a different aspect of the immune system than is celiac disease and gluten sensitivity. There really hasn't been much of an argument about that, but that was included in there, and so that would be a very simple test. It's positive or it's negative, and off you go. That one's pretty clear cut. With celiac disease, I was very happy to see that once the standard blood tests that were done, they mentioned TTG, also EMA, also deamidated gliadin. So those are some classic tests that they look for tissue destruction, which is very common with celiac disease, small intestinal tissue destruction. But where we've been kind of stuck for a very long time is thinking you absolutely had to have a positive biopsy in order to absolutely diagnose celiac disease. So they gave a nice nod in this article to the fact that if those blood tests were positive, and even if the biopsy was negative, that suspected celiac disease was still the diagnosis, which was great, because I can only imagine what it would be like to have been a fly on the wall in this room. They met in London last October, 15 of them, and obviously they didn't all agree. And I can tell from having had personal discussions with Dr. Fasano very recently, and the data that's in that article, you know there were compromises made. However, it was really nice to see the fact that they absolutely agreed on the fact that just because a biopsy was not positive didn't mean that someone absolutely did not have celiac disease. So that was nice to see. And then also in the area of gluten sensitivity, as soon as in this model that they created, as soon as the blood testing for celiac was negative, then the little arrow said suspected gluten sensitivity, which was wonderful, because what's been happening is as soon as those blood tests are negative, the patient's told, you're fine, go off and eat gluten, you're good to go. So in this model it said no, suspected gluten sensitivity. In the text of the article, it's about 12 pages long, they did mention anti-gliadin antibody as a possible test. So I think it's more than a possible test, but once again, you have to understand 15 minds all having to agree. So the fact that they mentioned that as a possible indication for gluten sensitivity is opening that door finally to an accepted blood test, because officially there is no accepted test for gluten sensitivity. So once again, they gave a little nod to that, which was good to see. And then also in the model, as soon as they had suspected gluten sensitivity, then they had a trial. Gluten elimination, provocation, and seeing a problem. So they absolutely validated that someone who felt better off gluten and felt worse when it was reintroduced, you could give a gluten sensitivity diagnosis to. So if you're not following this whole area as closely as I do, certainly, I know this might not sound earth-shattering, but trust me, it is. It's a very good sign, it's very good progress, and it will really go a long way to having doctors start realizing that there is such a thing as gluten sensitivity. They have to acknowledge it, they have to embrace it. Also in the article, just the final thing I wanted to mention was that it was also mentioned correctly that gluten sensitivity is very involved with extra-intestinal symptoms. So what that means is that symptoms are not just found in the digestive tract, but they're found in other parts of the body. So behavioral disorders, skin problems, joint problems, a whole host of things was mentioned, so that was also great. Anyway, so I gave you the reference, now you have it, bring it to your doctor, share it with your friends and family, and I hope this was helpful for you. Please send in your questions, your comments, give me an idea of what more you want to hear about in this area or in the area of clinical nutrition, and until next time, I wish you very good health.